Hello, I am Christine Georgichelle, student nurse, and for today's, I will be doing return demonstration in turning and positioning, moving and transferring client. Every time we perform, we must assess the client's ability to move and flexibility and review the medical records of a patient for condition that may affect ambulation and perform the pain assessment and assess the vital signs of the patient. Prior for performing the procedure, introduce yourself and verify the patient identity and ask how can you address the patient. As a nurse, we must explain what are we going to do and why it is necessary. This will help us to build or establish rapport to the patient, and this will make patient less anxious and more comfortable. Before performing, we must close the curtains for patient safety and privacy. And never forget to perform the hand hygiene because this will help prevent the spread of microorganisms. And after performing a certain position or moving, always ask the patient if they are okay or comfortable in that position. So let's begin. First, adjust the bed position. For you to easier adjust the patient, remove the blanket. Place your patient under the horizontal position. And then put the head of the patient under the 45 degree. Put pillow under the arm to prevent sore. And put pillow also onto the ankle to prevent the building of sore. And put the blanket. Done. First is put a trochanter to the side hips. This is to prevent the external rolling of hips. And place pillow under the knee to take the pressure off the lower back and for the patient to feel comfortable. And then put another trochanter underneath the ankle so that their heels are elevated. This is to prevent the muscle sores. And then place another pillow under the arm, but make sure that the wrists are higher than the elbow. And then spacing the finger to prevent contraction. And then place another pillow at the foot of the bed to prevent the foot drop. And lastly, give blanket to the patient so that the patient feels warm and comfortable. bed into the comfortable position. And I will move the patient towards me, but make sure to cross the arms and right legs of the patient and turn to the side on the count of 1, 2, 3. 1, 2, 3. And now we are going to place pillow on their back, but we have to fold this. Ma'am, can you lay down a little bit, but make sure that there are no pressure to the opposite shoulder. And then put pillows underneath the arms, going horizontally. And put pillow between the legs, going vertically. And then this pillow under the head, you can flip it over for the patient feel comfortable. And then lower the bed, make sure that they are aligned and locked. First is rotate the head on the side and place pillow under the side of the head to prevent flexion of spine. Second is check that her spine is straight to prevent the hypertension of spine. Place the upper arm near the head to provide comfort to the patient, and roll fingers to prevent the flexion and abduction of tongue. Place a rolled trochanter beside the hips and upper thighs of the body. And also place another trochanter between the legs. This is to prevent the internal rotation of femur. And since my patient is a girl, we need to insert pillows under her abdomen. And place another trochanter to the opposite side of heels. This is to prevent the pressure source when the patient is in prone position. First is move the patient to the right side. The arm of the back should be extended and the elbow of the other arm is slightly flexed forward. And then place pillow under the arm, but make sure that the arm should be slightly flexed. And then put other pillow between the legs, and also make sure that it is slightly flexed. And then put the sandbag below the feet. And put the other sandbag to the other feet. And then replace the pillow to the head of the patient for patient to be more comfortable. First is assist the patient to sit upright to the bed. And then place the table in front of the patient. Place the pillow on the table. And then extend the arm forward to support and help ease respiration. And then place another pillow on the back of the patient to provide the support. Are you comfortable, ma'am, with your position?
Yes.
First is adjust the bed for you to easier examine physically. Assist the patient to the horizontal recumbent position. And the foot will need to elevated so that the lower trunk is higher than the head and shoulders. And then provide blanket to the patient for the comfort. First is adjust the bed for easier examine physically. Assist the patient to the horizontal recumbent position, and head will be elevated so that the head and shoulder is higher than the lower trunk. And then last, put blanket for the patient comfort. Imagine that my patient is in the sitting position. First is you need to lock the brake and raise the footrest. And then exert pressure to the armrest and push forward into the standing position. And then pivot the patient toward the bed and assist the patient into the bed. And then give blanket to the patient. Imagine that I have my two assistant nurse beside me. First is put the patient into the flat position. By using any other blanket, move the patient to the side of the bed to prevent any friction. And on the count of 1, 2, 3, hold the patient while maintaining the body alignment. And in the count of 1, 2, 3, we need to pull this blanket to the side. 1, 2, 3. The other assistants will move towards to the other side of the bed and grasp the friction reducing device and roll the patient towards you. 1, 2, 3. And put pillows correctly to the head, to the spine, and to the legs. And last, give blanket to the patient to give comfort. First, raise the bed to the higher position. This is to decrease the distance that the client need to move up and sit up to the side of the bed. And position the feet to the edge of the bed. This enables the client's feet to move easily up the bed during the movement, and the client is aided with gravity into the seating. Place the arms over the head of the bed under the patient's shoulder and the other arms to the client's thighs. This is to prevent the clients from falling backwards. And then push forward the client. Imagine that these are the patient's sitting position, and you need to support the patient until the patient feels comfortable and well balanced. Ma'am, are you comfortable with your position? Okay, ma'am, are you ready to transfer you to the wheelchair?
Yes.
Please allow me to remove your blanket first.
Okay.
First, you need to cross your arms like this and slowly bend your knees. Don't worry because I will help you to do that. Slowly bend your knees. And in count of 1, 2, 3, you need to elevate your body, okay? 1, 2, 3. Slowly put your feet on the floor. Wear your footwear. And please allow me to put this gate belt around your waist. It helped me to easier transfer you to the wheelchair. I put my 1 feet front for your leg doesn't slip up. And put your hands on top of my shoulder. And in count of 1, 2, 3, I will lift you to the wheelchair, okay? 1, 2, 3. Place your foot here. And I will remove this belt. Are you okay, ma'am?
Yes.